America's healthcare crisis is unsustainable, and our political leaders are fumbling with failing solutions. Finger-pointing, shifting blame, it's not the same as true leaders coming to the rescue. Today, we have a guest who's dedicated his life to opening eyes and finding those solutions. Dave Chase is a serial entrepreneur who, apart from making his mark in technology and healthcare, is now hard-charging to unleashing a mass media effort to address our growing national nightmare. A great story that's being written right here on Red Hot Healthcare. Let's go.
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and great to have you aboard. I'm your host, Dr. Steve Ambrose. For past and upcoming episodes, find us on iTunes and most podcast directories, or on our eye-catching website, redhothealthcare.com. Dave Chase is the managing director of the Quad Aim Fund, executive producer of the Big Heist, and co-founder of the Rosetta Institute. He's spoken at TED and is the author of the forthcoming book, CEO's Guide to Restoring the American Dream: How to Deliver World-Class Healthcare to Your Employees at Half the Cost. Prior to this, Dave was the founder for what eventually became Microsoft's healthcare business unit, with more than $2 billion in yearly revenue. He also founded Avado, which was eventually acquired by WebMD. Dave, it's great to have you on Red Hot Healthcare.
Steve, it's great to be on. I've been enjoying your show, so honored to be a guest.
I'm glad we could get together. I know that we trade off communications quite a bit. I found your path to getting to the now moment today really interesting. If you could, why don't you share that a bit with our audience, Dave, your life story, especially in healthcare?
Yeah, I guess at the personal level, I'd start with my family and community is a big part of who I am, and thinking about what sort of place I'm going to leave my kids matters to me. And I've had the fortune of having great parents who are really good role models. One of the anecdotes that I think tells a lot about them is when they were newlyweds back in the day, they were audited by the IRS because they didn't think that somebody or a couple could give that much money making that little money. But in fact, they were. And then when they moved up to the community they're in now, I think within, 3 years or 5 years, they were voted Citizens of the Year. So they've set a high bar. And then I guess at a personal level, I've always just been very competitive and I was a competitive athlete in college, and I guess describe my athletic part of my life as an oxygen-fueled mountain athlete. And I just, I also love solving problems. Avado, like any startup, needed to look for a market gap. And, what I'll share with people is I went looking for a market gap, but what I found was, I believe, the greatest heist in American history. So after the acquisition and by WebMD and then leaving WebMD, I've really dedicated my professional life to solving that. And that's what the Rosetta Institute and the Big Heist is all about.
Yeah, Dave, you're an ideas guy, and beyond that too, clearly someone who executes on these. And one of the things that I really like about following you is not just your work on Forbes and in many other publications. I just think you're a real unique thought leader. But separately from that, you're always looking to push and get that bar higher and to really get that outreach out. So we're going to talk about that. But one of the things I'd like to get into beforehand is I'd like to get your take on some of the status quo resistance that's happening with changes in healthcare. A lot of good ideas. There are people, pushing the envelope like yourself, but there are a lot of companies out there, a lot of forces out there that may not want to see that happen. Maybe you could talk a little bit about your thoughts on that.
Yes, I'm fully sober about the level of entrenchment. And, of course, there's been a lot of efforts to try to change healthcare. And, one of the points that I made in my TED Talk was there's 3 trillion reasons to protect the status quo. And there's nothing easier to scare people about and politicize than healthcare, which are great ways to protect the status quo. And, it's about life and death. And of course, there's lots of perverse incentives. One of the things that's a common misnomer is that health insurance companies are actually interested in, managing costs. Here and there, that's the case. But overall, the incentives by the health insurance companies is really for costs to go up, particularly in a post ACA environment where their margin percentage was capped. And so they're very aligned with hospitals for cost to going up. And there's a lot of things that are kind of baked into the system that I think a lot of people don't fully recognize. Nobody lobbies more than healthcare. I mean, I think it's aerospace, defense, oil and gas, and financial services. You combine them, they add up to not even as much as healthcare. And it's not just at the federal level, it's the state level. I've seen, some healthcare innovators basically being harassed by state regulators who are good people, but they pretty much are obligated to follow up on complaints that some incumbents will file. And there are sincere efforts to improve things, but it does really require a rethink. We didn't get to better lighting and in homes and cities by optimizing oil lamp and candle technology. It really required a rethink. There's a number of us who've really been sort of defining this notion of health 3.0. And it's being defined by some very forward-looking doctors and it's sort of out there as a guidepost.
It's such an interesting point. A lot of consumers that initially favored Obamacare when it first came out really had no idea that a part of moving that forward was the president really having to accept the drug companies' demands that there'd be no negotiation with Medicare in particular. I think a lot of people, now that they are starting to open their eyes to this, recognize that, there's a real difference, I think, Dave, between this notion of healthcare versus the business of healthcare. When we talk about healthcare costs, I want to frame this out for the audience, just how bad things have gotten in healthcare, and especially in affordability. So give us an idea, if you could, of what type of numbers that we're looking at today.
Yeah, there's a few numbers. At the big picture level, healthcare's 27% of the federal budget. That's about 4 times what it was in 1976. It's clearly the number one overwhelming driver of wage stagnation and the number one cause of personal bankruptcy. We're the undisputed world leaders in medical bill-driven bankruptcy. And if you look at that, there's about 1 million a year, and 70% of those people actually had insurance. So, just having insurance alone doesn't solve it. And we're also at a time related to that wage stagnation issue where 70% of Americans have less than $1,000 in savings. Half of those people basically have no savings at all.
I think just to jump in, I think that's amazing. I don't think people really understand that, especially people at the top of healthcare and that are making decisions. I don't think they really understand that.
Yeah, it's amazing. There was this article in the Wall Street Journal in the last several months where they used some Brookings data and they showed very core things of how healthcare costs had gone up. I think it was 2007 to 2014 in the data, 25%. And what it came out of for the middle class, it wasn't like coming out of their vacations in Tahiti. This was coming out of food, clothing, transportation. They actually had a picture of a couple on their boat in Boise, Idaho, fishing because they couldn't afford protein in their diet. That is how bad it's gotten.
That's terrible. How do we get here? I think you and I spoke off air, and you told me something, Dave, absolutely staggering. You said that the average price increase for products and services over the last, 50 years is 8 times. So products and services have gone up in price 8 times what they were 50 years ago. But healthcare has gone up 274 times what it was. I just think that's amazing. How do we get to this type of problem? How did we get here?
Yeah, well, and it's worth noting that 50 years goes back to when Medicare passed. So that's interesting sort of data point there. But it's a combination of things. A big one is having so-called payers. I tend not to like that term because the real payers are all of us and employers. So it's, the health insurers, the health plans as our surrogates, and it becomes this dynamic of other people's money. And if you look at where more Americans get their health care overwhelmingly than any other source, it's employers. And so once upon a time, CEOs gave the responsibility of health benefits to HR when it was a small item, maybe 2% of their budget. And then you have the power of compound interest, really kind of snuck up on people to where it's the second biggest cost for most employers. And when you look at 20 years of wage stagnation, it's not because employers are stingy. They're spending far more money on employees than 20 years ago. The problem is every dollar and then some has gone to healthcare. And so that dynamic of other people's money is a big deal. And what we're starting to see is a recognition that the regulatory environment that employers operate under, and remember, about 157 million Americans get their healthcare through their employer. Most of them are self-insured. There's been this dynamic where on the retirement side, it's very well understood that there's this fiduciary duty. The whole idea of fiduciary duty is you're stewarding somebody else's money, and it's one of the highest standards, in the law. And so on the retirement benefit side, if you were putting employees' money into Uncle Bubba's investment fund that had high fees, terrible returns, and there were undisclosed kickbacks to the broker, you as an employer would get sued by employees as a class. That has happened a lot, and it's corrected that problem, and there's been cases that have gone to the Supreme Court. Well, we're essentially having Uncle Bubba's health plan. We know, according to PwC and others, that half the dollars we spend in healthcare don't add any value.
Yeah, and I do want to touch on something you said, and this is a point that you and I know we both agree on, and we're both proponents and followers of David Goldhill and his work. But this concept of other people's money, this sort of lulling to sleep, the notion that for years and years and years, the employers were really paying for the employees' health care, where in actuality, it really was, for the most part, the consumers or the employees' money that was going to it. It's just really wrapped into and sort of put into the concept of, your wages being stagnated, right? I mean, ultimately, doesn't this all trickle down at some level to being carried more by the employees than the employer?
Oh, yeah. I mean, the data couldn't be clearer about the cost shift that's happened. And that's one of the things that, Goldhill's book is excellent, Catastrophic Care. And he gives an example of one of his employees, and he projects, Becky is this millennial that he projects her to basically have a pretty healthy life, and make some assumptions that were quite conservative about healthcare cost growth and her income growth. And it was remarkable. I actually represented this in my TED Talk as an iceberg, where in his set of assumptions, she was going to earn $3.8 million in her lifetime. And healthcare was going to consume, in this really optimistic scenario, quite frankly, healthcare would consume half of that, 1.9 million. And this iceberg metaphor I used, about a third of that was above the surface. That's her share of premiums and copays. But there's this other 2/3 that's real and incredibly well sourced that we're all paying for. There's no sort of like magic pot of money where healthcare gets paid. It's all coming out of our wages and our tax dollars at the end of the day.
Yeah, something that so many people don't really recognize. This is Dr. Steve Ambrose. As a healthcare influencer, I'm in contact with some of the brightest minds and most powerful leaders in the industry. But my best effort comes from outside the booth. Knowing how to engage patients is an art, science, and philosophy that I know very well. I'm a hired gun that brings expertise to healthcare organizations of all types. You've heard my words. Now read my thoughts on my free white paper called The 7 Mistakes Made in Patient Engagement. Just go to redhothealthcare.com/learn. That's redhothealthcare.com/learn. While you're on the site, dive into my consulting and speaking services and schedule an initial call. You won't regret the uniqueness, benefits, and results I can deliver for you. And now, back to the show. Let's get into your insights and efforts with Health Rosetta, because this is really, I think, cutting edge. You've analyzed and taken a look at the situation. You've worked with a lot of other people, and you've come up with what seems to be a workable long-term solution to solving a lot of the issues with healthcare costs. So I'd like you to get into Health Rosetta, Dave, and some of the ways that that's actually being used successfully today.
Yeah, it goes back to when I did a root cause analysis of virtually every dysfunctional aspect of healthcare, and you ask the 5 whys, it always came back to we just purchase healthcare really poorly. That's in the public and private sector. Frankly, it's not even specific to the U.S., but most of our effort is focused on employers right now. And what we found was really exciting, that basically every solution to fix healthcare had already been invented and proven and modestly scaled. It's certainly still the exception. Just like the Rosetta Stone decoded the indecipherable Egyptian hieroglyphics, for a lot of people, fixing healthcare is viewed as indecipherable. So I just gave it a name, Health Rosetta. These are the folks who've done it. There's organizations like Rosen Hotels that I talked about in the TED Talk, but many others. And they've tackled it. They're spending 20 to 55% less per capita on health benefits with some of the absolute best benefits packages in the entire country. The thing that we kept finding every place was the organizations that had achieved the triple aim, which we're all pretty familiar with: better patient experience, better outcomes, lower costs. They actually focused in on the 4th aim, which is really common sense. Take care of the care team, both the professional and non-professional members of the care team. Sadly, we have record levels of burnout and dissatisfaction amongst nurses and doctors, and it's only common sense that that is going to impact the patient experience and ultimately outcomes, as the Lancet and others have reported.
You do bring up the example of Rosen and Rosen's hotels in your Health Rosetta, and I would encourage our listeners today and I know you're going to mention this, to go to healthrosetta.org. I'd like to ask you, with the solutions that you offer, which make a tremendous amount of sense to me, why aren't we seeing mass adoption with them? Why aren't companies just clamoring over and climbing over each other to get to those solutions and start implementing them en masse?
Yeah, great question. Unfortunately, most aren't aware that it's possible, but that's really the point, is to wake people up. Sadly, a lot of people look at tackling healthcare like trying to tackle Middle East peace. Like, they know that's a big problem, but they think it's unsolvable. And of course, the thing I alluded to earlier is, as CEOs of employers and outside board members wake up to the legal jeopardy that they are now in, where there's a legal target on their back with the fiduciary issue around ERISA, that is a tremendous motivator. And you also, frankly, have a dynamic where HR people are overloaded. They've got a lot of things on their plate, and they tend to just think that the best route is to not sort of upset the apple cart. The story that was told to me recently I liked was by a large private equity firm. They have, I think, about 600,000 employees in all the companies they own. And when they acquire a company, they have a group that is just focused in on, realizing greater value from their health benefits. They'll have a sit down with, say it's a manufacturing company they just acquired. The first question they'll ask is, "Hey, how's your healthcare business?" And they'll usually get a puzzled look. Like, "Well, I'm in a manufacturing company here." And then they'll know what they spend on healthcare. And let's say it's $38 million on health benefits. They'll say, "Well, how's your $38 million healthcare business?"
Oh, wow.
And then they go, "Oh, wow. Would you apply the same resource and type of talent to that $38 million division that you're applying to health benefits, very few cases that is actually the case. And so that's this mindset shift. And you look at companies like IBM who've shifted that mindset to not only can you get a lot more value out of that supply chain input, but if they're going to compete, they're going to compete on talent and having greater talent than maybe lower cost competitors. And so they're all about optimizing that talent, and that brings a different mindset with it.
Yeah, it sure does. I'm connected with, from Virgin Pulse, a gentleman named Rajiv Kumar, and it's the arm of Richard Branson's empire that deals with wellness. And he told me that when they reach out to a company to come on, and I think they service 125 of the top 500 global companies in their wellness, he says it's really all about coming on, not just meeting with the HR, but getting the HR and the talent teams and the talent acquisition people at a company to meet, because they typically don't talk to each other. The HR people and the hiring people, especially when it comes to talent and employee engagement, they don't look at wellness and they don't look at sustainability as being interlinked. I wanted to also mention one other thing here that you said, Dave, I really caught up on, was this idea of just the HR department doing what they've always done and not wanting to shake things up. I often wonder if some of the HR executives that make these decisions and set the strategies simply are looking at their own jobs and they're saying, my gosh, I have it really good here and I don't want to blow good things, so why take a risk on something that's not a status quo insurance plan that we've always used?
Makes complete sense. And you can understand, given that a lot of times the only time they hear anything from the CEO when it comes to benefits other than the shock every year when the rates go up is when somebody complains. So it doesn't exactly set up the right dynamic there. And so when you look at the organizations who've successfully tackled healthcare and really gotten tremendously more value out of it, it's been from the top, the CEO, the COO, the CFO who drive it. And then, they, of course, have to have the back of the HR and the teams to make it happen and apply the right resource. So, you're spot on regarding that point.
So let's go from a top-down discussion to a bottom-up one. We're about to get into talking about a project that you've been working on, a passion of yours called the Big Heist. And just before we get into that, I'd like to go ahead and set the stage a little bit about the approach you took on that effort coming from the bottom up. You've talked about this at your TED Talk, and talk about why a bottom-up approach makes more sense to basically finding a long-term sustainable solution for healthcare.
Well, when I, make the statement that I think that we've gone to war for less than what healthcare is doing to America, and I look at it as the most paramount issue, I look at other big societal challenges that we've been tackling over the last 50 years where we've made progress. And if you look at those, things like civil rights, better food, energy independence, climate, and so on, all those movements started from the bottom up. Now, eventually the politicians will run to the front of the parade, but what you see there is typically there's a movement that gets started, and then media and film play an integral role in sort of waking up the rest of the country. And so whether it was in MLK's day, it was the morning newspaper and the evening news. If you look at things like better food, it was Super Size Me and Food Inc. And climate, it was Al Gore's film, and so on. They happen from the bottom up. The thing is, what you see, recently in the health reform discussions is kind of top down. Pretty much they're just talking about rearranging the deck chairs on the Titanic. Simply shifting who pays for what does very little to address the underlying dysfunction.
I'll just jump in with that. One of the funniest things I know that you probably noted was when Donald Trump came in, whether you like Donald Trump or not as president, when he came in and said, we're going to go ahead and we're going to have healthcare cross state lines now. You can buy healthcare from cross state lines. That's going to really help. And you realize he's getting this from the health insurance companies who were advising him, who, as we talked about before, right, Dave? I mean, they just want to keep the status quo the same. So, and the media is just buying it as if, this is something magically that's going to transform healthcare because you can buy policies or you'll be able to buy them across state lines. So I just want to jump in with that. It just seemed to hit me when you were mentioning this.
Yeah, well, and talk about presidential elections. Certainly the 2016 presidential election was the most unique of my lifetime. And I think the biggest media whiff of the entire election, I wrote about this in Forbes after the Michigan primary when there was a surprise win by Bernie and Trump, was they were casting about for all these reasons. And so after Michigan, of course, with the automakers being there, I was listening to some NPR interview and they had this narrative around trade. And despite having a Dartmouth economist on where they said, oh, this is about wage stagnation, that's about the middle class and all that, which is true. And they tried to pin it on trade. Even though the Dartmouth economist said, no, wage stagnation is about healthcare. GM didn't move jobs to Canada because they have low wages.
Right.
It was about healthcare. And so that's the big story that media just did not clue into, where that's underlying the angst. And let's face it, there a 20-year-long economic depression, a definition of economic depression is 2 or more years of flat or decline in income. That's longer than the Great Depression. Crazy stuff happens when you have those type of dynamics.
We talk about Supersize Me. We talk about The Big Short and other sorts of movements that come around generated from movies, generated from media. Let's tee up The Big Heist. Take us through that effort if you could, Dave, please.
Sure. I started with this dichotomy where you have this Health Rosetta that's, practically a utopia by comparison to the near dystopian status quo that we have in healthcare. And I sort of joked, it's just a marketing problem. Of course, everybody would want, this Health 3.0 type of thing, but it's a marketing challenge of the century. And that's when I, going back to my earlier comments, I was like, gosh, how do you wake up America about that? And so it's like, gosh, you got to do a film. That's the way you do it these days. And I put it out there and hope somebody would run with it. And they're like, that's a great idea. You should do it. I'm like, wait, I don't know anything about making films. But I realized, this is something where it's really just like any other startup in some sense, that if you've got a big idea, you've got a way to build a world-class team, you can do it. And so I've got a business partner who's a former Sony and Disney president, and we're going at it. This is going to be a full-blown feature film, sort of like The Big Short for healthcare. And then a little scoop for your audience, because originally we were thinking about this as a documentary in terms of the film itself. But what we're going to do is we're getting so many stories in. The dysfunction is broad and deep. We've got a Tell Your Story link on the site. Is we're going to start kind of crowdsourcing these kind of mini documentaries. And so there's more to come there, but we know that one downside of a full-blown scripted feature film is it's going to take longer and more money. And we want to get these stories and build the community around this. So it's exciting. There's a lot of stories. Unfortunately, some of them are really horrible to read. I mentioned one of them in my TED Talk where a pretty well-known Northern California healthcare system is pressuring the doctors to amputate diabetics' feet because they get paid $22,500 an hour versus $200 an hour to manage diabetes. It's just repulsive stuff, but it's actually happening.
Oh, my God. I shouldn't be amazed, but once again, I am. With The Big Heist, I want to ask, you're looking for a crowdsourcing stories, correct? And I want to make sure that at the end of the show here that you give us some links, Dave, not just to Rosetta and The Big Heist, where people can write in if they have their own personal stories, certainly our show listeners. I certainly want them to have a part in that if they'd like to contribute.
Yeah, definitely. The starting point for that is going to the Big Heist movie site. I think it's just bigheistmovie.com. And we have a Tell Us Your Story. We're going to be adding some additional things so that people can submit video versions of that and think of them almost as audition tapes that then we'll cull through And then that's what will be fodder for these kind of mini documentaries, and and it will inform the film itself.
Let's get into another quagmire, I think, and that is keeping your physicians, your nurse, and your healthcare staff happy and engaged. With risk and regulation going up, Dave, and costs needing to be driven down in healthcare, how do you see the healthcare sector adapting to it and keeping their workforce, their physicians and their nurses, engaged and happy?
Yeah, I mean, there was a great quote from Leonard Kish, patient engagement's the blockbuster drug of the century. And really what's the corollary to that is if you're in a value and outcomes-based world, guess what? Most of the outcomes are driven by what happens outside the clinic, that other 99+% of their life. So it's not, being patient-centered and focused, unfortunately in a lot of places just becomes this marketing trope and sort of a little marketing veneer versus you don't have a prayer to succeed in a value and outcomes-based world without patient engagement. And guess what? You know how you get patient engagement is when you have really taken care of the care team. I mean, again, it's
Right.
common sense. The care team is done well. That naturally leads to an improved patient experience. That's when the kind of magic partnership happens between the patient, the family, the caregiver, and the non-professional caregiver and the care team. That's what drives the best outcomes. And in the right models, that drives the lowest cost. So that's really where things happen.
And Dave, just keeping on that point, I tend to do a lot of work, not just in patient engagement, but certainly in employee engagement. One of these people that I follow is a gentleman by the name of Josh Burson. One of the things that he talks about is some of the major studies in employee engagement in other sectors that talk about what keeps employees happy. One of those being an ability to feel as though they really are able to contribute and take on more challenge. Do you see ever a way to integrate that sort of mindset into today's providers and nurses? Not just that their jobs are already hard enough and they have a high degree of difficulty and knowledge, but to really take some of that same employee engagement mentality and perhaps work that in through maybe a cultural change in hospitals and different health organizations.
Yeah, unfortunately, that hasn't been happening enough lately. And I think that's one of the drivers of dissatisfaction amongst doctors and nurses as they're increasingly being treated as cogs in the wheel.
Right.
Versus, really a core member of the team where they have, within a team environment, they can have some, autonomy and ability to really practice at the top of their license, which a lot of times is not happening, where they're just being told to check these boxes and go through these motions, and they just kind of become what I call, milk in the back of the store, kind of lost leaders and referral machines versus fully using, all of their training. I mean, that's the thing you bump into when I've interviewed docs who broke out of those systems. They were saying, gosh, I was only using 40% of my medical training. I just didn't feel it wasn't satisfying. I didn't feel it was ethical, and I just had to break out.
Dave, I want to go ahead and finish up on a personal question, and that is, I'd like you to tell our audience something that you know to be true, that very few people agree with you on.
It really gets at the heart of what we say on our healthrosetta.org site. Healthcare is fixed. We just need to scale the fixes. We don't need to invent some new thing. I'm all for technology advances, but it's out there. This is a process thing. The first thing that I think I learned as a new consultant was don't throw technology on top of a broken process or automate a broken process. And healthcare is just riddled with that. The EMRs are a great example of that. And so the organizations that are really achieving the quad aim, they get the process right. And then they turbocharge it with technology. And that's what leads to radically better outcomes, lower costs, better patient and care team experience. And everybody would want that if they knew about it. Sadly, we were talking about politics earlier and people who call themselves conservatives and there's others who call themselves progressives. Unfortunately, there's a lot of preservatives out there. They just want to preserve status quo. I think that's much of the way the political system is set up. And inside of organizations, there's preservatives ruthlessly clinging to the status quo who want to stop progress, which I think is very anti-patient, anti-competitive, and frankly, anti-American. So healthcare's fixed. We just need to scale it.
Dave, that's great. The last thing I'd like to do is to have you tell our audience a bit more about how they can reach out to you in terms of Health Rosetta, in terms of the Big Heist, and how they can connect, maybe contribute either financially or just personally through their own effort.
You bet. HealthRosetta.org is a great jump-off point to the Nonprofit Institute, the film, the book. There's all pretty easy to find links there. I mean, just fantastic people working with some of the most forward-looking individuals in the industry. It makes it really easy to get up every day and work with them. And so we're doing that with people both at an individual level as well as at a corporate level. And so invite you to go there.
Dave Chase, Managing Director of the Quad Aim Fund, Executive Producer of The Big Heist, and co-founder of the Health Rosetta Institute. Dave, it's been great having you on Red Hot Healthcare today. A pleasure, and look forward to hearing how everything is going to move with you in the future.
Well, it's been fantastic to be part of the show. Thanks again for the opportunity.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.